Can you see my is it in slide mode for you guys?
Yes.
Yeah. Okay, super. Um, yeah, thanks for the introduction, Laura. I won't add anything else to that because that was brilliant. Yeah, my name's Christine, and yeah, today during the talk, I guess I'd like to kind of try and cover a little bit about why I think it's important to think about the ways in which our welfare systems depend on and are kind of part of that addiction to economic growth. I work in a centre that is focused specifically on post-growth economics, and it kind of is centered around this idea that we have something called a kind of growth dilemma that sits at the heart of the economy. And the basic concept there is just that we are addicted to, dependent on economic growth to have an economy and a society that is functioning well. It's a sort of we can't live with growth because it's tied to and coupled to ever increasing use of environmental resources, and it's like being kind of tied to carbon emissions, etc., like very, very tightly coupled. And we're not really seeing any evidence that we can decouple that trend, so increase growth without increasing carbon emissions fast enough. Like there is some decoupling happening, but it's not happening fast enough for us to meet those sort of key targets, like the 1.5 or even 2-degree targets. So we can't live with growth because it's kind of leading us towards environmental collapse, and we also can't live without growth because that way, historically and based on the way that our economy is structured today, leads to social collapse. We know that during periods of recession, it's very, very poor for outcomes for people. There's evidence around increasing morbidity and deaths associated with, specifically, usually with austerity. I think rather than necessarily the decline in growth per se that's the issue, it's like the ways that governments respond and react to those periods of low growth that create the poor wellbeing outcomes. So we have this sort of, this growth dilemma that sits at the heart of the economy. And we know that in order to meet the kind of climate targets that we need to meet for a livable planet, that it's going to take pretty drastic action in terms of decarbonisation. And that kind of rapid scale change to our economy and a shift away from these very highly energy intensive forms of energy is likely to have an impact on our economic growth rates. And beyond that, we also know that we have been, for the last 40 years or so, even more than 40 years actually, 60 years, in a period of secular stagnation, which effectively means that the kind of average growth rates of the economies across the OECD has been declining over time anyway. And there's lots of arguments as to why that is the case, but essentially we kind of land in a position where looking at how our economies depend on growth and trying to think differently and trying to move towards a growth independent or a post-growth economy is something that is not only precautionary because it's likely that we're moving towards a sort of secular stagnation in the growth rate anyway, but it's also something that's desirable because we know that the sort of negative impacts of growth dependency already are showing in the economy, and I'll get into that in some more detail, but also it's desirable from an environmental perspective, and also from a perspective of, having more growth resilience means that during those sort of fluctuating times of low growth, we're not ending in this sort of societal collapse spiral. So that's a kind of very brief summary of the sort of justification for why we want to look at this research, just to give me some more time to talk in more detail about growth dependency specifically, and look at the kind of sector specific example of adult social care. So we define growth dependency as the conditions that require the continuation of growth in order to avoid significant physical, psychological, social, or economic harms. So under the definition or the way that kind of we as a centre approach growth dependency, it's not just about national economic growth, but we can also think about the ways that individual firms and sectors have a dependency and a need for growing revenues, increasing the kind of inputs, environmental labour inputs into the sector in order to kind of maintain stability within that sector or within that firm. So we look at growth dependency as being a kind of across an axis from macro level growth dependencies down to micro level growth dependencies as well. And we can also think about growth dependencies in other axes, like, for example, who will be harmed in the absence of economic growth, or who is the actor that is driving or requiring growth. Sometimes those two are not the same. Sometimes, if we think about adult social care, the actor that is driving for and requiring economic growth is not the same as the actor that will be should we say, like, existentially harmed by the lack of growth. So we might have like private equity firms that are driving for increases in growth in revenue, but actually when that growth stops, it's often the residents and the workers who are harmed. So growth dependency is like a multifaceted concept that, again, I'll unpack as we go through the talk, but I just wanted to give a bit of a flavour of the kind of depth and nuance of this topic beyond this idea of just, we depend at a national or global level on GDP growth. So we decided to take specifically a sector-led approach to try and unpack in a bit more detail the mechanisms and structures that embed growth dependencies, like what are the actual concrete dynamics that are meaning that growth is necessary for the sector. And we chose adult social care in the UK in particular for a number of reasons. It exhibits a number of trends that kind of elucidate the growth dependency issue. So the first is growing demand as a result of the aging population. The second is that there are kind of workforce challenges around pay and retention and labour productivity growth limitations. And the third reason that we chose adult social care is that it's a heavily privatised and financialised system, which means that we have the profit motive and the sort of financialised drivers within that sector as well. So it kind of allowed us to look at quite a broad range of drivers of growth dependency. So in this way, it sort of acts almost as like a little microcosm of the like national broader economy. Okay, the very briefly, the characteristics of interest in the adult social care system that helped us with understanding this are, one, that it's a quasi market. So the fact that there are both government run care homes, but the majority is privately run. I think 96.5% private and 3.5% public. And half of the money that flows into the sector comes from central government and half of it comes from individuals. So again, we have this very like multi-layered sector that can allow us to look at a lot of different dynamics between different actors, and actor constellations and vested interests are really quite central to growth dependency. So that made it a very interesting sector for us. Over the course of the like 3 or 4 years that we spent looking at the sector, we drew out 3 key processes or dynamics that are generating growth dependencies within the adult social care sector. The first is rising demand. I've written here, but we kind of talk in our paper about growth in manifest needs. So manifest needs, as opposed to just needs, are those kind of human needs that manifest themselves as a demand on the welfare system. So in terms of the growth dependency for the welfare system, what matters is apologies. Obviously, I haven't spoken enough today yet. Yeah, what matters is the kind of the growth in those needs that then present themselves as a demand on the welfare system. And if you have a situation where you have a growth in manifest needs that outstrips the growth in efficiency of labor, material, or energy use, then you'll end up with a shortfall in the production of need satisfiers. So those are the ways in which we satisfy our needs. So in this case, it would be, for example, what we do find in the adult social care system is that obviously already we have unmet need, like I think it's the recent Age UK stats was like 2 million older adults with some level of unmet care need. That need is rising, and labour productivity growth is not able to keep up with that need. So and not only is it just that we don't have enough workers, but also actually labour productivity has declined in adult social care since 1997 by about 10%, which means that we have this kind of increasing gap between the needs and the efficiency with which we can use labour, material, and energy. On top of that, it's not only a kind of quirk of the UK system, but actually fundamentally, labour productivity growth is limited in sectors like the adult social care sector because if you think intuitively, if you ask a care worker to see more patients per hour, that's going to reduce the quality of care delivered rather than improve it. So in terms of growth dependency, this system is very challenging from a demand perspective because we have this continued growth and we also have a kind of labour, material and energy efficiency that's not able to match that growth in order to continue to provide services at the appropriate level. So move on to the second. Yeah. Okay, the second process that we found that was driving growth dependency in the adult social care system in the UK was growing labour costs. So, I mean, I think it's quite clear as to why that creates a growth dependency. If you have growing costs of the labour force, you're going to need increasing revenue for firms and also growing GDP for the government to fund, the government-funded portion of that in order to continue to meet the costs of the workforce and continue to deliver the same amount of care to the same individuals. Now, the increasing labour costs is driven by a phenomenon known as Beaumont's cost disease. So the key to this is that we can, very broadly speaking, think about the economy as it's really a scale, but in simple terms, in two lumps. We have the fast sector, this is the terminology used by one of my colleagues, Ben Gallant, fast sector and the slow sector. In the fast sector, we find that labour productivity grows very rapidly, and in the slow sector, it doesn't. And so what that means is, in the fast sector, let's say you need one worker to produce one mug, and then you have labour-saving technologies that are implemented. That means that actually you can produce 10 mugs with one worker. That means that you don't need to employ as many people, or you can and you can increase wages, etc. So what we find is that as a result of the disparity between the fast sector and the slow sector, that labour becomes relatively more expensive in the slow sector, because in the fast sector, wages increase commensurate with that kind of increase in labour productivity growth. And that drags wages up in the slow sector, because if you didn't have a kind of commensurate increase in the wages in the slow sector, you would find that employees would just move from the slow to the fast sector. So there's this kind of like drag upwards, and the labour productivity growth in the fast sector brings the average wages in the economy up. So what we find then is, because there's not a commensurate increase in labour productivity in the slow sector, that per unit output, we have an increase in the cost of the workforce. Now, in adult social care, we also know that labour productivity has actually reduced. So, kind of in absolute terms, as the wages have increased in the sector to keep up with the general trend of increasing labour productivity growth in the economy, find that care is becoming more and more expensive per unit output over time. So again, inevitably, economic growth is the sort of silver bullet that's been used to try and help to tackle this issue. I mean, it obviously cuts much, much broader than just adult social care, but just keeping to this sector, yeah, we can clearly see that growth is needed. It's like we have a dependency on growth in order to keep up with these rising demand and also the rising costs of the workforce. The third dynamic that we looked at and found was driving growth dependency in the adult social care system is the pursuit of economic rents, specifically through predatory financing. So if we think of, I know that there's like a big discussion in the literature about defining economic rents, but if we think sort of broadly about economic rents as like rewards for assets that are not easily replicable, so often like large assets, and where the rewards are disproportionate to the labor that's been put in by the recipient. We can think about rent seeking as driving that growth dependency because usually what happens is we have like an investor of some sort who will use risky and costly predatory financial practices in order to ensure that they're getting their return, so they're getting the rents that they're seeking. But the strategies that they're using are highly risky, highly costly, which creates this like need for revenue growth, for again growth in GDP, because we know again the government is funding a lot of the places in care homes that are owned by these privatized, financialized companies. I think it would be helpful to talk through maybe a specific example to explain a little bit in more detail exactly how the predatory financial practices embed a growth dependency. Because this is one that we spent, some more time looking at because there are so many different, mechanisms through which this financialization is creating this growth dependency. So another thing that's important to say here is that like the higher the expected return on investment by these investment firms that are buying up care homes and embedding these kind of predatory financing tactics, the more risky the strategies they will use. And we're talking about things like debt leveraged buyouts, asset stripping, offshoring of profits, etc. And it's really an important part of the picture because around 1 in 8 care home beds in the UK are owned by investment firms. So it's a substantial amount of the market that is kind of under the pressure of this need to deliver return on investment to investors. Debt leverage buyouts. They are effectively where a kind of large investment firm, maybe a private equity fund, will buy a care home chain and use basically a large loan to finance the purchase of that firm, instead of just using like 100% capital. So you can see in scenario A, if the purchase of a care home were 100% equity financed over the kind of course of the ownership of that care home chain by the private equity company, their sort of return on investment at the end would basically just be equivalent to the value growth by the end point where they sell it. If they use a big chunk of debt and a small portion of equity, over time, the cash return of the company is used to pay down the debt, which increases the equity portion that's owned by the private equity company. And so when they sell the care home on at the end of the investment horizon, they're not only getting return equivalent to the value growth, but also the increase in equity as a result of the cash flow of the company being used to pay off the debt. Now, this sort of strategy is not like a kind of neutral financing strategy. It's very risky. There have been some papers that, or one paper in particular, that links debt leverage buyouts across the economy, not just in adult social care, but with an 18% increase in risk of insolvency. We also know that in the UK in particular, in financialized firms, 16% of the average weekly bed fee goes towards paying off interest on debts. So this is like a really substantial chunk of what individuals and local authorities are paying for the care home beds is going towards paying off debt specifically in these kind of financialized parts of the market, which, as I say, is about 12% of the market, 1 in 8 beds. Revenue growth is some hidden slides there that I didn't know were there. Well, that's a nice surprise. Revenue growth in this case is needed to keep up with, sorry, just keep your eye on time, needed to keep up with interest payments, rent payments, because when they do the asset stripping thing and they sell off the physical care home, often they will like split the care home operating company from the company that owns the physical care home. So there's the services wing and there's the wing that owns the physical asset, or they might sell the asset off to an external landlord. In any case, the bed fees are used to pay off the interest, rental costs, which often are increasing kind of even faster than market rates. We have dividend payments, we have management fees, like this slide that I've got up at the moment shows you the complexity of the corporate structure that sits behind just one of these big providers. HC1 is one of the biggest providers in the UK. And you can see also that like the blue boxes are where the sort of holding companies are based in the Cayman Islands or Jersey, these kind of big offshore tax havens. All of these structures kind of create a financial precarity that is paid for by the government, by individual savings, etc., that is geared towards delivering return on investment for investors and not towards providing good quality care in the care homes. And all 5 of the 5 largest care homes in the UK have exhibited at least 2 or 3 of these different predatory financing tactics. So it's like among the financialized part of the market is very, very prevalent. Okay. Yeah, the next point I'd like to make is just that growth dependency is already leading to poor outcomes for workers and service users. This is not something that is like a kind of conceptual idea that's important if we transition to a post-growth economy. It's not like a utopian thing. Like already the adult social care sector depends on economic growth in order to function properly. And there hasn't been the sufficient growth in revenue in the sector. And as a result of that, we are seeing those harms that I talk about in that definition of growth dependency, that if growth stops, it leads to these existential harms. Like that is exactly the situation that we're in the UK care sector at the moment. There's insufficient money coming in, and we have growth in aging. We have the growth in the cost of labour. And we have this leaky bucket issue of money being like siphoned off at the top for to meet the costs of a financialized system. We interviewed about 16 care workers from care homes that were owned by private equity funds and hedge funds, etc. And we found very concretely that as a result of this kind of financially constrained system, instead of the investors absorbing the kind of reduced return on investment, they were cost shifting onto the workers and the service users. So the people who were suffering from this lack of growth in the system are the workers and the service users. We found that the kind of care home companies were cutting corners on maintenance, on sanitary products, food, that they were massively understaffing the care homes. And when I interviewed workers, we found quite clearly that people were very aware that this was because they were taking money out the top and that they were not paying adequate care and attention towards either the workers or the service users. So here we just have a handful of quotes that demonstrate the kind of seriousness of the situation that is already already embedded in this in the sector. I think the bottom quote is particularly potent. Lisa says, that's what I think the company used so much of, the caring factor of the individual who cares for the residents. And it's almost like an unspoken ransom. If you leave, what's going to happen to the residents? So there's this sense that it's a very intentionally structured system that is exploiting the care and goodwill of the workers and the powerlessness of the residents to really affect change in the care homes. So with all that in mind, the main takeaway from today should be hopefully that growth dependency is not an inevitability. It's something that is built into the welfare system through a range of structures and mechanisms, but that we can unpack those, understand what they are, and identify levers to then reduce growth dependency, which will then have a host of co-benefits, not only in terms of, the like broader environmental context that I spoke about at the beginning, but also in terms of like right now improving outcomes for workers, for service users. So yeah, another key point here actually is that the sort of state of growth dependency means that although more money is desperately needed to be funneled into the system from central government, like that is absolutely unquestionable, but that is not sufficient on its own. We have a bucket that is growing because of the aging population and the labor costs. And then it's also a leaky bucket because money is pouring out to places where it's not actually serving good for the residents and workers. So what can we do? Here I sort of describe a broadly systematic approach that we can take, I think, across a range of sectors, because adult social care is not the only sector that's suffering from growth dependency right now. And in a second, I will just sort of briefly unpack the different kinds of structures that we want to look at when unpacking growth dependency. But another thing that this always makes me think about actually is the film Speed. Not that I think I've seen that for about 15 years, but just that idea that like we have a kind of bomb that's sitting at the heart of the economy, and if the bus slows down below 50 miles per hour, that everything's going to explode. Like, yes, that is kind of true in the way that we've structured things at the moment, but we built the bomb ourselves, and we have the tools and the ability to like unbuild it. Like it's not some like magical alien bomb that's arrived, and we're totally powerless to do anything about it. We actually can we can change the structures that are locking us in this really rigid way to economic growth. So some of the structures that I have looked at are finances. Financial legal structures. So in this case, I'm thinking about like privatization and marketization of adult social care, and the way that introduces the possibility for rent seeking in the first place. We have infrastructure. So the fact that the adult social care system is it's a very asset-rich sector, which made it very appealing in terms of these debt-leveraged buyouts. So there we can think about what sort of policies and levers can we pull around making it harder for there to be asset stripping and debt leverage, over leveraging of companies with debt. Here we can look at the policy structures. So we also know in adult social care that there is a real dearth of effective legislation around exploitation of workers and predatory financing practices. Like there's just not good oversight, and the market oversight has almost zero teeth to actually do anything about it if they do find that a company is financially in a precarious position. So we would look at legislation options. Then we can think about power dynamics. So again, in a marketized system, we know that the local authorities have some sort of power over providers because they are like responsible for paying for the care of a large number of individuals, which means that they can effectively like cap the price that they're willing to pay for care. We also know that providers have power over individuals, both workers and residents in the system. So like thinking about those like power dynamics and the actor constellations is really important in a growth dependency context. And then norms like the kind of societal devaluing of care work, meaning that maybe it's a topic that is not getting as much public attention and media attention as it otherwise would. So these like analyzing these sorts of underlying structures is a really potent way of identifying the specific levers that you can pull to reduce growth dependency and deliver some of those co-benefits. So when we were working on adult social care, we looked specifically at how to rein in the financialization of care by improving the transparency of care providers, like financially, because a lot of the reports, the financial reports, where these big companies are like the ultimate owner company of like HC1 is based in an offshore tax haven, which makes it very difficult to see where money is flowing within the system. Looking at mandating onshore ownership, limiting debt leveraging, etc. So there's these sorts of like potential options around reducing financialization. We can look at strengthening workers' rights so that they, when it comes to that like squeeze, that they're not the ones that are kind of the weak point in the system where they can be leaned on and exploited because of their desire to deliver appropriate care to the people that they're working with. We can looking at new ownership models. And the last one is moving towards a non-profit care of a model of care, which obviously removes the possibility in theory for particularly the very extreme forms of rent seeking that we see in other parts of the sector. It is true that some charities do have some similar structures to some of even the financialized care providers. So it's not like a total panacea, like there still does need to be regulation and oversight, etc. But certainly I think we can assume that like non-profit models of care are likely to be like less vulnerable to some of these predatory strategies. And then I think it's, to me, there's really an argument around experimenting with having like a kind of pluralized care system where there's room for experimentation around having preventative, relational, low resource models of care, things that can look at how do we reduce some of those growth dependencies around the aging population, around the costly workforce, etc. So lots of levers that we can kind of look at. I think I had, yes, okay, yeah, no, so I'm right at the end, and I was just going to say my kind of main takeaway points then from today are that tackling growth dependency is part of a precautionary approach to climate change mitigation. Like it's not something that is in any sense beneficial, being addicted and dependent on economic growth, and it's something that can offer both social and environmental benefits moving towards a growth independent system. That there is the second takeaway point is that there is a way of looking systematically at this challenge, and the kind of framework that we've developed, we are already in the process of applying it to other systems. I've looked at in a quite a light touch way at housing. We're now applying it in a much more in-depth way to the pension system. Next year, I'll be looking at healthcare. So it's like taking this approach and unpacking like how these structures are present across different parts of the welfare system. And then lastly, just that moving towards a sort of post-growth adult social care system, post-growth welfare system is something that should be good for people and planet at the same time. But it's not easy, you know. It's not like this is a straightforward thing to do, and there are lots of those structures, underpinning structures, particularly around the vested interests, that are mighty sticky and very difficult to shift. But it is something that, you know, it's not this like looming impossibility, which I think is the prevailing narrative, is that like, well, without growth, what are we going to do? And the answer is there is stuff that we can do. So thank you. I'll stop screen sharing.
Thank you, Christine. That was great and impeccably timed. So we've got about 20 minutes or so now.